Lichen planus. Lichen planus was first described by Aramus Wilson in the year 1869 as a chronic non-infectious, I repeat, this is a non-infectious inflammatory disease involving the skin and mucous membrane. It may involve skin only or else the mucous membrane or the combination of the both. Inflammatory dermatological condition involving the lesions of the skin and mucous membrane. Coming to the cause is idiopathic. We don't know the exact cause for the Lichen planus. Sometimes it may be a medicinal induced also, like non-steroidal anti-inflammatory drugs, anti-malarial drugs, beta blockers, etc. Sometimes the Lichen planus can be induced by the use of the medicines also. Coming into the epidemiology, 0.2 to 1% of general population are get affected by the Lichen planus. Among them, 1 to 4% a oral Lichen planus are said. Usually, it appears in the age between 30 to 60 years, and as I told, it's an autoimmune disorder. The most of the autoimmune disorders are comparatively more seen on the females than that of the males. So it's not mandatory, but it's a general rule I can say. Most of the autoimmune disorders are more seen on the females and infectious diseases are more seen on the males. So it won't hold good in all the cases, but it's a general rule. So this general rule is applicable in the Lichen planus also. So females are more affected than the males. Coming into the types or variants of Lichen planus, based on the area involved of the Lichen planus, this can be classified as cutaneous Lichen planus, so which is involving the skin area, and mucosal LP, which is involving the mucosal layer like buccal mucosa or penile mucosa, etc. Lichen planopilaris, which is involving the scalp of the person. LP of the nails, Lichen planus of the only involving the nails, and drug-induced LP. Coming to the pathology, as I told, is an autoimmune disorder. So some medications like antimalarial drugs, NSAIDs, beta blockers, etc., and some viruses like hepatitis C will activate. I can say it's abnormal activation of CD8 plus T cell. So this abnormal activation will destroy our own cell. So this abnormally activated immune cells will destroy our own cells. If it is affecting the skin, then we get that cutaneous Lichen planus. If it is involving the buccal mucosal layer, we may get the mucosal Lichen planus. And sometimes foreign metals like copper, gold, mercury, which are used in the dentistry, which may cause a Lichen planus of the oral mucosa or even the lips also. So simple removing of this foreign material will sort out the problem. Most commonly involved areas are bilateral arms or bilateral ankle or on the back, scalp and oral mucosa. So these are the most commonly involving area. Coming to the clinical features of the Lichen planus. So it's a flat topped lesion. The word meaning of Lichen means a grounds of the tree just, and planus means a flattening. So it's a flattened top will be there, and itching is the another character that is pruritic and well demarcated. There will be a clear cut demarcation between the pathological lesion and non-pathological skin. Papillae or plaques are seen and its shape is polygonal. The lesion shape is polygonal. Becomes striae, which appears as fine white lines with lace-like pattern, is called as becomes striae. This is seen in the LP of the buccal mucosa. And in the oral Lichen Planus, the healed lesions are seen in the brownish discoloration. Nails, longitudinal lines are seen on the nails, and the pterygium in the nails may occur. The skin over the nail bed may protrude over the nail. White reticulated milky white plaques are seen in the mouth, Lichen Planus, and patient may be asymptomatic also, and sometimes they may have the pain or burning sensation with mild irritation of the food also. There are 6 P's to remember the clinical features of LP. It's a peripheral, usually it affects the peripheral part of the body. The papules are seen and polygonal in shape and purple in color, pruritic, the itching will be there, and it may affect the penis. Coming to the diagnosis part, in the most of the cases, this is based on the clinical diagnosis only, but sometimes we may need to confirm it by the biopsy. Biopsy is more confirmative, and we have to screen the patient for the viral infections like hepatitis C also, which is said to be one of the cause for the Lichen Planus. Coming into the treatment part of the Lichen Planus, it's a self-limiting disorder. So it's a self-limiting. So in the most of the conditions, it resolves within 1 to 2 years only. It requires antipruritic treatment, which will reduce the itching sensation, and corticosteroids plays a promising result in the treating the Lichen Planus. Of course, it has its own side effects, and topical steroids or infiltrated steroids are used for infiltration, local infiltration. So oral retinoids, and as I told you, this autoimmune disorder, we can use the immune suppressants also. Coming to the home remedy, aloe vera is another drug. The pulp of the aloe vera plant is used to apply on the skin, which has a bit of anti-inflammatory action, and it will reduce the itching as well as the growth of the lesion. Turmeric is known for its anti-inflammatory action. The powder of the turmeric, which is mixed with the water, the paste can be applied on the cutaneous lesions as well as the buccal lesions also. Or else you can mix the turmeric with the honey and apply it for the buccal mucosa. Coming to the Ayurvedic approach, Araggodadi Kashayam. So this the combination is chosen based on the literatures available or publications are made on the Lichen Planus. Araggodadi Kashayam, which helps to reduce the itching, that is Kandu is a, and Triphala is an anti-inflammatory action, and Jatyadi Gruta. So this Gruta should be prevented applying on the buccal mucosal lesions because it has copper sulfate within it. So these are the Lichen Planus are grown above the level of the skin, and the copper sulfate will help, or Thutta will help us to reduce the lesion, the size of the lesion, as well as to reduce the inflammatory action. And Arogya Vardhinivati, so this is the tablet, so which helps to treat the Lichen Planus. I personally use Mukhadoshakahara Churna, which is the combination of the Lodra, Vacha, Dhanyaka, and Kusta. So I use this combination to mix with the honey. This is in the powder form. Mix it with the honey and apply on the buccal mucosa. Or else plain application of the honey itself may be sufficient in the most of the conditions. So this is all about the Lichen Planus. If you like this video, then kindly subscribe to the channel and press the bell icon. Dear friends, so this is only a informative video. Okay, so don't go for self-medication, and this video will not help you to diagnose the condition, and this is not to be taken as an alternative for your physician opinion. Okay, so If you are wishing to take the Ayurvedic treatment, you can go for the Ayurvedic physician, and Western medicine, you can go for the Western physician. Okay. Thank you. Thanks for one and all for watching my video. Thank you one and all.